This presentation is on diabetes by Jamie Blake and Kenya Allen. Diabetes is destroying many lives in the state of Georgia. These lives could be saved if enough community outreach and guidance is given to these individuals at a younger age. Diabetes describes a group of metabolic diseases in which the person has high blood glucose, blood sugar, either because insulin production is inadequate or because the body cells do not respond properly to insulin, or both. Chronic conditions such as strokes, heart disease, obesity, diabetes, and cancer have been on the rise every year. According to Atlas, chronic conditions account for approximately 75% of the medical costs in the U.S. The total estimated cost of diagnosed diabetes in 2012 was $245 billion, which includes $176 billion in direct medical costs and $69 billion in decreased productivity. Decreased productivity includes costs associated with people being absent from work, being less productive while at work, or not being able to work at all because of diabetes. People with diabetes aged 60 years and older are 2 to 3 times more likely to report an inability to walk 1/4 of a mile, climb stairs, or even do housework, compared with people without diabetes in the same age group. Diabetes is the 7th leading cause of death in the United States. Due to the complexity of chronic conditions, especially since they are most preventable, it seems feasible to approach caring for patients through the view of treating the whole man, mind, body, and spirit. The state of Georgia accounts for approximately 9% of the 29 billion people in the United States that are suffering from diabetes. The prevalence of diabetes increases with age in the state of Georgia. Elderly Americans in Georgia tend to have a higher prevalence than the rest of the population, at a rate of over 24%. African American elders with diabetes are significantly higher than other ethnic groups at a rate of 23%, in comparison of Caucasians at 12%. Georgians 65 years of age and older have a significantly greater prevalence of diabetes than any other age group at 23%, which was 9.6 times the prevalence of diabetes among groups 18 to 24 years old. In the state of Georgia, diabetes is obviously a huge concern. It is estimated that 1 million suffer from this deadly disease, 350,000 of whom don't even know that they have it. If present trends continue, it is estimated that 1 out of every 3 children, 1 in 2 minority children, faces a future with diabetes. The issues that the diabetic elderly African American population in Georgia faces are vast. Many will encounter additional chronic illnesses as a result of their diabetes, such as heart disease, stroke, hypertension, blindness, kidney disease, and amputations, just to name a few. Approximately 78% of elderly African Americans in Georgia reported to have access to a regular primary care doctor. There are assessment tools used to diagnose, monitor, and investigate diabetes. Physicians will utilize assessment tools such as the A1C test, which measures the blood glucose averages over a 2 to 3 month period. The fasting plasma glucose test, FPG, is a quicker method which assesses fasting blood glucose levels. The oral glucose tolerance test measures how the body processes glucose over a 4-hour period using a special sweet elixir. Lastly is the random test, also known as the casual test, which can be administered at any time of the day for those who are displaying severe symptoms. Now, once physicians diagnose a patient with diabetes, a specific treatment plan and health monitor is put into place. A typical diabetic treatment may include drug therapy, oral or insulin, diet modification, increased exercise regimen, and constant glucose testing and monitoring. Now, in the elderly African American population, diabetes assessment is particularly important due to the high risk factors in both the elderly and African American populations. Elderly African Americans are more prone to accelerated congestive decline due to poor health monitoring. There is a huge community outreach in the state of Georgia. There are local Atlanta agencies that also provide diabetic resources to the elderly African American population. For example, the Diabetes Association of Atlanta, which provides free screenings, educational classes, and in-home services not only to the elderly African Americans, but all in the Atlanta metro area who are suffering. In addition, the agency promotes diabetes awareness within the community by holding health fairs and various organizations such as the HOSA Feed the Hungry. The American Diabetes Association, Atlanta North Georgia Region Office, is so committed to educating the public about how to stop diabetes and support those living with the disease. They put together numerous events and fundraisers. The most recent are Step Out Atlanta and the American Diabetes Association Expo. Step Out was just that. It was a walk for diabetes and to raise money for these people and for research. These people got out and got some exercises, and they were supporting a really good cause. The expo was a free event which included free health screenings, proper cooking demonstrations, product and service exhibitors, as well as leading experts talking about diabetes management, the research going into diabetes, and how to prevent diabetes. The free health screenings included blood glucose and blood pressure. The Georgia Diabetes Coalition, GDC, is also an organization that serves as a unified voice for members dedicated to improving the quality of life for those with and affected by diabetes. That group has implemented the 2020 campaign, which is a digital media campaign conducted by the Georgia Diabetes Coalition and the American Diabetes Association. They dedicate the 20th of every month to the awareness of diabetes and its complications. As a part of this campaign, they provide monthly messaging and patient education materials to hospitals, employers, churches, pharmacies, and diabetes educators around the four most common They speak on the four most common diabetic complications, which are blindness, amputation, kidney failure, and DPN. The 2020 campaign information is distributed via social media networks, Facebook and Twitter, church bulletins, and partner newsletters on the 20th again of each month. What else can be done? A policy that should be in effect is how to implement a prevention class where we are teaching our youth. So the most important factor when it comes to diabetes is a way to prevent it. What could the community do to ensure the message is getting out to everyone, every single person? I think that the school district should come together and implement a prevention class. They need to go into details. Diabetes is caused from obesity, so these schools need to also be explaining the importance of a healthy diet, the importance of plenty of exercise, because there are many benefits to regular physical activity. Exercise can help you lose weight, lower your blood sugar, and boost your sensitivity to insulin, which helps keep your blood sugar within a normal range. Research shows that both aerobic exercise and resistance training can help control diabetes, but the greater benefit comes from a fitness program that includes both. From the front line, serving over 13 Atlanta metro counties, the Diabetes Association of Atlanta is on the front line towards making changes through advocating state leaders in Congress to provide additional funding and research resources. Assure competent public and personal health care workforce. Having assured competent public and personal health care PPHC workforce is essential components towards the care and education needed to treat diabetes. According to the CDC, the 4 essential services of public health assurance are: link people to needed personal health services and assure the provision of health care when otherwise unavailable. Assure a competent public health and personal health care workforce. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. In addition, to ensure a competent public and personal health care workforce requires recruiting the best candidates. This includes adequate and ongoing training in numerous PPHC areas that are connected to diabetes patient care. Training in areas such as cultural diversity, empathy, and active listening skills are also necessary to increase the quality of health services. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. Population-based services are for patients with similar clinical characteristics such as diabetes. The benefits of population-based approach health services, especially when dealing with components such as the elderly and minority groups like African Americans, it allows healthcare providers to identify members in priority populations and then to partner them with their practitioners to offer the variety of services. The state of Georgia passed a House Bill 879, which was also passed at House and Senate. The General Assembly found that they needed to protect school students. They have stated that in order to manage their disease, students with diabetes must have access to the means to balance food, medication, physical activity while at school and at school related activities. The school nurse is a preferred person. However, in the state of Georgia, they do not have a full-time nurse. So other employees need to get the training of how to help these students with diabetes. Preparations are needed to ensure that students with diabetes will be medically safe and have the same access to education opportunities as all students in Georgia. No later than August 1st, 2012, the Department of Education, in conjunction with the Georgia Association of School Nurses, shall develop guidelines for the training of school employees in the care needed for students with diabetes. There are many research funding programs. In 2013, the research program made $35.75 million available for research. This included more than 400 active research projects with approximately 375 investigators and 145 leading academic research institutes across the United States. The American Diabetes Association Scientific Sessions is the largest diabetic meeting in the world, bringing together nearly 18,000 participants, including more than 14,000 clinical and researchers from all 50 states and 117 countries. The 5-day annual meeting features timely and significant advances in basic science and the prevention, diagnosis, and treatment of diabetes. There are over 3,000 original presentations and about 175 exhibitors showcasing the latest in diabetes, related products, services, and technology available to all healthcare professionals. Diabetes is a serious issue, and in the state of Georgia, there are many resources that people can go to and get, and that they can self-help themselves. But it is important for the children to understand what diabetes is and what they can do now to prevent this from happening.